Hi, my name is Stephanie Weyrauch, and I'm a physical therapist here at Physical Therapy and Sports Medicine Centers in Orange, Connecticut. And today I'm going to talk to you about pelvic floor physical therapy. Why is pelvic floor physical therapy something that maybe you should pursue? Well, one of the things that we can do as pelvic floor physical therapists is we can help explain birthing positions to maximize pelvic floor relaxation during birth. We can help improve relaxation of the pelvic floor to ensure that something like intercourse is not painful, to improve urinary incontinence, and to improve bowel movements. We can also use pelvic floor physical therapy to strengthen the muscles of the pelvic floor to prevent any type of urinary incontinence from worsening. We can also utilize pelvic floor physical therapy to help improve aches and pains that come with pregnancy, including sciatica, low back pain, and even carpal tunnel syndrome. The first thing we want to make sure that the pelvic floor is doing is going through its proper range of motion. Just like any other muscle, the pelvic floor has to achieve its full range of motion in order for us to do a proper muscle contraction. So when we exercise, we stretch the pelvic floor to help it achieve its proper range. Once we have achieved the proper range of motion, then we can start actually strengthening the muscles and contracting the muscles properly. So that would include doing something like a pelvic floor contraction, commonly known as a Kegel. A condition that we commonly see as physical therapists that affect intra-abdominal pressure is diastasis recti. This is something that women commonly have after they go through a pregnancy. So the first exercise I'm going to show you is a pelvic floor stretch. And it's done in a position that is commonly known in yoga called child's pose, but we're going to modify it a little bit. You're going to start on your hands and knees. You're going to bring your knees out a little bit and your feet together. And then you're going to rock back onto your heels just like this. And your goal is to try to let your pelvic floor muscles relax. You're not going to bear down, but you're thinking about letting your pelvic floor kind of move down towards the wall. You can make this a little bit easier by adding some deep breathing and do some diaphragmatic breathing by breathing in through your nose and out through your mouth. Focusing on letting your rib cage move and not necessarily your chest. So the next exercise I'm going to show you is to help stretch out the sciatic nerve. One of the pelvic floor muscles, called the piriformis, is a very common muscle to get stiff and tight, especially during pregnancy, that can cause pain. I'm doing this exercise on a Swiss ball because the roundness of the ball and kind of the depth of the ball helps to provide input to the pelvic floor, allowing a person to decide and to understand whether their pelvic floor is relaxed or contracted. You're going to stick your leg out like this, keeping your toe flexed up towards you. Your hands are going to go on your hip, and then you're going to lean forward like this so that you feel a stretch down your leg, and then come right back up. So this is more of a pressure on, pressure off, focusing on trying to keep that nerve moving and stretching out the muscles of the legs. We're next going to stretch the muscles on the inside of our leg. These are called the adductor muscles. And a lot of times, if these muscles are really tight, it can cause the pelvic floor muscles to not move through their proper range of motion. So you're going to start in tall kneeling, putting your hands on the floor, taking one leg, putting it out like this, and you're focusing on trying to keep your back nice and flat. And then you're just going to rock back and forward in a dynamic motion, trying to get a little bit of a stretch in this part of the hip. I'm going to show you another pelvic floor stretch. This is another common yoga pose. It's called Happy Baby. So you're going to start on your bottom like this. You're going to roll back onto your back, grab your toes, and lift the toes up like this with your knees turned out. And then you're going to hold it, focusing on trying to let that pelvic floor relax. If this is too difficult for you and it's hard for you to grab your toes, you can modify this exercise and just grab the knees and pull your knees to your chest. Again, you don't want your knees to be in, you want to be out in this position, and then you're going to hold it. If you have any other questions about pelvic floor physical therapy, you can visit ptsmc.com.